Thank you very much. I want to say thank you to the Vienna NGO Committee for this opportunity to be part of the 2021 CND meeting. My name is Peggy Chukwuemeka, and I'm from Nigeria. And I'm here to talk about links between money laundering and drug trafficking. I am here as part of the delegation of World Federation Against Drug, an NGO in consultative status with ECOSOC. But the worker present today is that of Parent-Child Intervention Center, PCIC. PCIC is an NGO in Nigeria working in the areas of drug and substance abuse prevention, mitigation of sexual and gender-based violence, and good governance. PCIC is a member of World Federation Against Drugs, Civil Society Network on Substance Abuse Prevention, Nigerian Network of NGOs, and more. There's a close relationship between money laundering, drug trafficking, corruption, and other forms of organized crime, including trafficking in persons, trafficking in firearms, cybercrime, terrorism, and financing of terrorism. This poses a significant and growing threat to national and international security, with their implications for public safety, public health, democratic institutions, and economic stability across the globe. Not only are criminals networks expanding, but they're also diversifying their activities. Drug traffickers have derived ways to launder drug money, and there are quite a number of methods to conceal large sums of currency that are generated by illicit drug sales. Other laundering methods are also through casino, wire transfer companies, and smuggling currencies out of the United States. However, the detection of money laundering is impeded by various national laws that protect financial, communication, and data privacy. In a significant number of countries, bank secrecy laws hinder obtaining comprehensive information about financial transactions by prohibiting banking officials from releasing customer information to persons outside the financial institution, or simply by prohibiting access by foreign law enforcement agencies on the ground of national sovereignty. The globalization of trade, finance, and communication have made it easier to transport illicit drugs and launder process, and Nigeria remains one of the major drug transshipment points and a significant center for criminal financial activities. Individuals such as internet fraudsters, corrupt officials, and businessmen, as well as criminals and terrorist organizations, take advantage of the country's location, porous borders, weak laws, corruption, inadequate enforcement, and poor socioeconomic conditions to launder the process of illicit drugs. And the process of illicit drugs in Nigeria are derived largely from foreign criminal activities rather than domestic activities. Drug traffickers reportedly use Nigerian financial institutions to conduct currency transactions involving US dollars derived from illicit drugs. Our Parent-Child Intervention Center, as an NGO with focus on drug and substance abuse prevention in Nigeria, has not only been working with the National Drug Law Enforcement Agencies, NDLEA, we are also working with, in partnership with the Nigerian Economic Financial Crime Commission, EFCC. And this is because we know that drug trafficking and money laundering will be reduced if demand for illicit drugs is reduced in consuming countries like Nigeria. In the course of our work in Nigeria as an NGO, as an organization, we have also carried out activities in partnership with HEDA Resource Center and the tracking of illicit financial flow by the Nigerian elites. PCIC and HEDA are working towards training and involving Nigerian university students to also get involved in tracking of illicit financial flows in Nigeria. And we are optimistic that if Nigerian government will be more serious in prosecuting the offenders of both drug and trafficking and money laundering, there will be reduction in crime and terrorism funding. We therefore recommend that domestic and international anti-money laundering cooperation and regulation be strengthened, and there should be an increase in funding for treatment, prevention, economic development programs to reduce drug production, sales, consumption, and trafficking. Thank you very much.